My name is Raimi Bryan. This is my head-to-toe assessment for the spring 2026 semester of Dr. Mitchell's class. This is January 23rd, 2026. This is my patient, Rob. I am going to begin this video with scanning my room, including all tabletops. There's a tabletop, floor, ceiling. Here's behind me. And here's the other tabletop. Okay, and we're going to start the assessment. I am going to begin by assessing the skin on the head, face, and neck. Prior to starting this video, we did assess the skin of the anterior and posterior chest and abdomen for patient privacy. So to begin, the color is normal for ethnicity, the temperature is warm, the texture is smooth, the moisture is dry, there's no edema present, the skin target is intact, there is no evidence of bruising, scarring, lesions, or nevi present. Okay, I will now assess the head. We'll start with inspection. It is normocephalic. It does align at midline, and it is symmetric. I'll now inspect and palpate the hair on the scalp and the face. The hair is evenly distributed. It is a natural brown color. The texture is a medium thickness and smooth. There is no evidence of any tenderness, infestations, depressions, nodules, or masses noted. Okay, I will now assess the temporal arteries. We'll palpate them bilaterally for any tenderness. There is no tenderness present, and it is 2 plus and equal bilaterally. I'll now palpate the lymph nodes. We'll start with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and the supraclavicle. There's no evidence of enlargement or tenderness noted with palpation of the lymph nodes. Okay, I will now assess for TMJ. I want you to open and close your mouth. Okay, there's no subluxation, crepitus, or tenderness present. Patient's negative for TMJ. I'll now assess cranial nerve number 5, which is trigeminal. We'll assess the motor and the sensory function. I want you to open and close your mouth. Okay, and clench your jaw. Motor function's intact. I will now assess the sensory function. I want you to close your eyes and tell me if you feel a dull or a sharp sensation.
Sharp, sharp, dull, dull.
Okay, keep your eyes closed. Tell me what part of your face I'm touching.
Forehead, right cheek, left cheek, nose, chin.
Sensory function's intact. Motor and sensory function's intact. And cranial nerve number 5 is intact. I'll now assess cranial nerve number 7, which is facial. I want you to smile, frown, raise your eyebrows, squint your eyes, and I want you to puff out your cheeks, puff out your lips. Cranial nerve number 7 is intact. I'm now going to assess the ears. I'll start with inspection. They are well-informed, well-aligned, and symmetric. I'll now palpate the pinna and the tragus bilaterally. There's no evidence of tenderness, nodules, or masses present. I'll now do the otoscope exam. I'm going to look in both ears at the auditory canals and the tympanic membranes. Okay, other side. The auditory canals are clear, patent, free of discharge bilaterally. The tympanic membranes are pearly gray bilaterally. We'll now assess cranial nerve number 8, which is vestibulocochlear. I'll do that with 3 different hearing tests. We'll start with the whisper test. I'm going to whisper 2 words into each ear and tell me what you hear.
Cat, dog, red, blue.
No hearing loss noted. I will now perform the Weber test. I'm going to place this vibrating tuning fork on your forehead, and I want you to tell me if you hear the vibrations equally in both ears.
I do.
Okay. Weber test is normal. I'm now going to perform the Rene test. I'm going to place this vibrating tuning fork on your mastoid bone and then beside your ear. Tell me when you can no longer hear the vibration.
I can no longer hear it. Can no longer hear it.
Other side.
Can no longer hear it. Can no longer hear it.
The Rene test is positive with air conduction 2 times greater than bone conduction. Cranial nerve, no hearing loss noted. I will now move on to the eyes. I will first inspect the eyes. They are symmetric. I'm also looking at the eyebrows, eyelashes, and the palpable fissures. All features are symmetric with even hair distribution. Now I'm going to assess the sclera and the conjunctiva of both eyes. The sclera is white, the conjunctiva is pink, and is free of discharge bilaterally. I'll now assess cranial nerve number 2, which is optic. We'll start with our vision test with our Snellen chart. I want you to cover your right eye and read the bottom line.
LTFPH.
Now I'll cover your left eye and read the bottom line.
LTFPH.
And both eyes.
LTFPH.
Vision is 20/20 bilaterally. We will now, I'll now perform a peripheral eye exam. I want you to cover your right eye, look straight ahead, and tell me what numbers you see.
2, 1, 2, 1.
Okay, and cover your left eye and tell me what
2, 1, 2, 1.
Okay, peripheral eye exam is normal. Cranial nerve number 2 is intact. So I'm now going to assess cranial nerve number 3, which is oculomotor. Look straight ahead. I'm going to shine my pen light in your eyes. Pupils are round, reactive to light, and 3 millimeters in size bilaterally. Cranial nerve number 3 is intact. I'm now going to test for accommodation and convergence. Look with your eyes only with my pen light. Okay, accommodation and convergence is normal. I'm now going to test for the conjugate gaze and the 6 cardinal fields of gaze. I want you to look straight ahead and follow my pen light with your eyes only. Okay, we did assess cranial nerve number 3, 4, and 6 with that test. Number 3 is oculomotor, number 4 is trochlear, and number 6 is abducens. The extraocular eye movements were symmetric, well coordinated, and cranial nerves number 3, 4, and 6 are intact. Okay, I'm now going to do the ophthalmic exam. I want you to look straight ahead for me, and I am assessing the red light reflexes and the internal structures of the eye. The red light reflexes are present and positive bilaterally, and the internal structures were visualized. There is no evidence of narrowing or enlargement of the optic arteries and veins, and the optic discs were seen, and they are round with well-defined and sharp margins. Okay, we will now move on to the nose. I'm going to first inspect the nose. It is straight and midline. I am now going to test for cranial nerve number 1, which is olfactory. I want you to close your eyes and tell me what you smell.
Alcohol.
Other side.
Alcohol.
Cranial nerve number 1 is intact. I'm now going to assess the nares bilaterally. Look straight ahead for me. The nares are clear, patent, and free of discharge bilaterally. No evidence of septal deviation noted. Okay, I'm now going to assess your sinuses, frontal and maxillary. Okay, there's no evidence of enlargement or tenderness to frontal and maxillary sinuses. I'm now going to assess the mouth and the throat. So I want you to stick your tongue out for me. Okay, and move it to the right, left, up, down. I am visualizing the lips, the teeth, the gums, the buccal mucosa, the palate, the tongue, under the tongue, the salivary glands, the tonsils, and the posterior pharynx. The tonsils are rated at a 1+ bilaterally. There is no evidence of redness, swelling, gum disease, cavities, masses, or discoloration noted. I'm now going to test for cranial nerves number 9 and 10. Number 9 is glossopharyngeal. Number 10 is vagus. I want you to stick your tongue out and down and say ah. Okay. The soft palate and the uvula rose with phonation symmetrically. Cranial nerves number 9 and 10 are intact. I'm now going to assess for cranial nerve number 12, which is hypoglossal. Stick your tongue out and move it rapidly to the right and left, and rapidly up and down. Okay, the tongue moves symmetrically. There is no evidence of tremors, atrophy, or fasciculation noted. Cranial nerve number 12 is intact. Now I'm going to move on to the neck. I'm first going to inspect it. The neck is supple and midline. I'm going to palpate the trachea. The trachea is midline. I'm going to palpate for the thyroid gland. I'm going to move your trachea to the left and swallow. I'm going to move it to the right and swallow. The thyroid gland is non-palpable. There is no evidence of nodules, masses, or tenderness noted bilaterally. Now I'm going to assess the carotid arteries. I'm going to palpate them one at a time. The carotid arteries are 2+ and equal bilaterally. I'm now going to auscultate the carotid arteries for any evidence of a bruit with the belt of my diaphragm. I want you to take a deep breath in and hold it. Okay, other side, take a deep breath in and hold it. No evidence of a bruit to the left of the right carotid artery. Okay, we're now going to move on to your posterior chest. I'm going to first begin by inspecting the chest for any signs of respiratory distress. There is no cyanosis, no nasal flaring, no tachypnea, there's no retractions, accessory muscle usage, or tripoding noted. I'm now going to inspect the general appearance. It does appear to be symmetric bilaterally with no evidence of deformities. I will now palpate for symmetrical chest expansion. Take a deep breath in and out. The chest did rise symmetrically. I will now palpate for tactile firmitas. With each touch, I want you to say 99.
99, 99, 99, 99.
Equal vibrations were noted bilaterally. I will now percuss the intercostal spaces. Cross your arms in front for me. Okay, resonance is noted throughout bilaterally. I will now auscultate the lungs with the diaphragm of my stethoscope. With each touch, I want to take a deep breath in and out. Breath sounds are present, clear, and equal bilaterally. There are no signs of adventitious sounds noted. Okay, I'm now going to test for egophony. With each touch, I want you to say E.
E, 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 E.
Egophony is negative bilaterally. I'm now going to test for bronchophony. I want you to say 99 with each touch.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Bronchophony is negative bilaterally. I'm now going to test for whisper pector illiqui. With each touch, whisper 99. Whisper pector illiqui is negative bilaterally. I'm now going to assess the anterior chest. You can turn around. I'm first inspecting for any signs of respiratory distress. There's no nasal flaring. There's no tachypnea. There is no cyanosis. There's no tripoding, retractions, or accessory muscle usage. Now I'm going to assess the general appearance. It does appear to be symmetric with no deformities noted bilaterally. I'm now going to palpate for symmetrical chest expansion. Take a deep breath in and out. The chest did rise symmetrically. I'm now going to palpate for tactile firmitas. With each touch, I want you to say 99.
99, 99, 99, 99.
Equal vibrations noted bilaterally. I'm now going to auscultate the anterior lungs. With each touch, I want you to take a deep breath in and out. Clear and equal breath sounds noted bilaterally with no sounds of any adventitious sounds noted. I'm now going to assess the heart. I'm going to start by assessing the 5 heart areas. We're going to auscultate each area. I'm going to start with the aortic. And I am going to use the diaphragm and the bell to assess high and low pitch sounds. So aortic, right intercostal space, right sternal border, second intercostal space. Pulmonic, left sternal border, second intercostal space. Erb's point, left sternal border, third intercostal space. Tricuspid, left sternal border, fourth intercostal space. And mitral, left midclavicular line, fifth intercostal space. I will now assess the same areas with my bell. S1 and S2 heart sounds noted, no additional heart sounds noted, no murmurs or gallops noted. I'm now going to palpate for the point of maximal impulse, left midclavicular line, fifth intercostal space, and there are no heaves, lifts, or thrills noted. Now I'm going to auscultate for a full minute the apical pulse with the diaphragm of my stethoscope. Left midclavicular line, fifth intercostal space, and it has been 1 full minute, and the apical pulse is 76 beats per minute and a regular rhythm. Okay, you can lay down for me. I'm now going to assess for jugular vein distension. I'm going to move our camera. Okay, and I want you to raise your head 30 degrees and turn your head to the left. Okay, I'm going to palpate for the sternocleidomastoid muscle. I'm locating the jugular vein. It is flat. There is no distension and no visible pulsations noted. You can lay flat. Now I'm going to inspect the chest for any heaves or lifts. There are no visible heaves or lifts noted. I am now going to palpate each area of the heart for any thrills. So the aortic, pulmonic, tricuspid, or Erb's point, tricuspid, and the mitral. There is no thrills noted upon palpation. I'm going to listen to all 5 areas of the heart with my diaphragm and the bell of my stethoscope. So we are going to do the aortic, the pulmonic, the Erb's point, tricuspid, and the mitral. I'm also going to listen with my bell to all 5 heart areas. S1 and S2 heart sounds noted. There are no additional heart sounds noted, no murmurs or gallops noted. I am now going to I'm now going to inspect the abdomen for contour and symmetry. The abdomen is flat, it is symmetric, there are no visible pulsations noted. I'm now going to auscultate the abdominal arteries for any bruise. I'm going to use the bell of my stethoscope. We're going to start with the aortic, the right renal artery, the left renal artery, the right iliac artery, the left iliac artery, the right femoral artery, and the left femoral artery. There are no bruises noted with auscultation. I will now listen to the vowel sounds in all 4 quadrants of the abdomen with my diaphragm, the right lower quadrant, the right upper quadrant, left upper quadrant, and the left lower quadrant. Vowel sounds are noted and normoactive in all 4 quadrants of the abdomen. I'm now going to percuss the abdomen, including the liver and the spleen. Okay, I want you to take a deep breath in and hold it. Okay, there is tympany noted throughout. There is dullness noted over the liver and tympany noted over the spleen. I'm now going to palpate all 4 quadrants of the abdomen for any tenderness or masses. Start with right lower, right upper, left lower. There is no tenderness or masses noted to the 4 quadrants of the abdomen. I'm now going to palpate the liver and the spleen. Okay, and then take a deep breath in and out. Okay, the liver and the spleen is non-palpable and non-tender. Okay, you can stand up for me. We're going to assess for the CVA tenderness. Move our camera. Okay, and I want you to tell me if this is tender. Okay, CVA tenderness is negative bilaterally. We're now going to move on to our musculoskeletal exam. We're going to start with the upper extremities, which includes the fingers, the wrist, the elbows, and the shoulders. I'm first going to inspect and palpate the upper extremities, including the joints. There's no evidence of redness, swelling, nodules, crepitus, or tenderness noted. I'll now assess the capillary refill of each finger. Capillary refill is less than 3 seconds in all 10 fingers. I'll now assess the radial pulses, and they are 2 plus and equal bilaterally. We'll now assess for range of motion. We'll start with the fingers. I want you to mimic my movements. We are going to start with flexion, extension, hyperextension, abduction, adduction, and then thumb finger opposition. Full range of motion noted to all 10 fingers. We will now assess the range of motion of your wrist, flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. Full range of motion noted to the wrist bilaterally. We'll now do your elbows. I want you to do flexion, extension, hyperextension, 90 degrees for me, supination, pronation. Good job. Full range of motion noted to the elbows bilaterally. We'll now do your shoulders. I want you to do flexion, extension, hyperextension, internal rotation, external rotation, abduction, this is abduction, adduction bilaterally, okay, and circumduction. Full range of motion noted to the shoulders bilaterally. We'll now assess for strength. We'll start with hand grip strength. I want you to squeeze my hands. 5 out of 5. Grip strength noted bilaterally. We will now do bicep and tricep strength. Push me away, pull me in. 5 out of 5 strength noted to the biceps and triceps bilaterally. We'll now do shoulder girdle strength. I want you to hold your arms straight out, push my hands up, pull my hands down. 5 out of 5 strength noted to the shoulder girdles bilaterally. We'll now assess for cranial nerve number 11, which is accessory. I want you to shrug my hands up. Cranial nerve number 11 is intact. We'll now assess for stellar-bellar coordination with 3 different movements. We'll start with a serial finger rapid movement. So take your fingers and touch them to your thumbs very rapidly, both hands. Good job. We'll now do the hand flip-flop test. I want you to put your hands in your lap and go supinate. Good job. Last one is finger-to-finger test. I want you to take your right index finger, touch your nose, and then my finger every time I move it. Good job. Now do your left index finger. Good job. Cerebellar coordination is intact. We will now assess for sternosis and gravesthesia. I want you to close your eyes. I am going to give you an object in your hands, and I want you to identify it. This is object 1.
Key.
Good job. And I'm going to do object 2.
Q-tip.
Good job. Sternosis is intact. We'll now test for gravesthesia. I want you to close your eyes, open your palms. I'm going to draw 2 objects on each hand and tell me what I draw.
R, 4. B, 3.
Gravesthesia is intact. Sternosis and gravesthesia are intact. I'm now going to assess the skin of the upper and the lower extremities. The skin is normal color for ethnicity. The temperature is warm. The moisture is dry. There's no edema present. The skin turgor is intact. And there's no evidence of bruising, nevi, scarring, or lesions present. We will now assess for the light touch sensation. I want you to close your eyes. And I want you to tell me what part of your body I'm touching.
Right arm, right leg, left leg.
Light touch sensation is intact in the upper and lower extremities. We'll now do the vibratory sensation. I want you to, I'm going to place this vibrating tuning fork on various parts of your body. I want you to tell me when you can, when you feel it and when you no longer feel the vibrations. We'll start with the wrist.
I feel it. I no longer feel it. I feel it. No longer feel it.
Okay. We'll do the proximal ulnar prominences.
Feel it. No longer feel it.
Other side.
Feel it. No longer feel it.
Okay. We'll do the medial malleoluses.
I feel it. No longer feel it. Feel it. No longer feel it.
Okay, the vibratory sensation is intact in the upper and lower extremities bilaterally. We'll now assess the deep tendon reflexes. We'll start with the brachioradialis. I want you to hold your arms like this. Okay, brachioradialis reflexes are 2+ and symmetric bilaterally. We'll now do the bicep. I'm going to place my thumb on your arm. And then we'll do the tricep as well. Bicep and tricep reflexes are 2+ and equal bilaterally. We'll now do the patellar. Okay, other side. Patellar reflexes are 2+ and equal bilaterally. We will now do your Achilles. I'm going to dorsiflex your foot. Okay, and dorsiflex your foot. Okay, 2+ and symmetric to the Achilles deep tendon reflexes. We'll now do the Babinski reflex of both feet. The Babinski reflex is negative bilaterally. Now I'm going to move on to the lower extremities. I will start with inspection and palpation of the lower extremities and the joints. There's no redness, no swelling, no nodules, no crepitus, or tenderness noted. I'll now assess capillary refill of all 10 toes. And capillary refill is less than 3 seconds in all 10 toes. I'm going to assess the dorsalis pedis pulsus. They are 2+ and equal bilaterally. I'm now going to inspect the posterior tibialis pulsus, and they are 2+ and equal bilaterally. We'll now assess for range of motion in the lower extremities, including the toes and the ankles. I want you to mimic my movements. Flex your toes, extend, hyperextend. I want you to adduct them. Good job. For range of motion noted to all 10 toes bilaterally. We'll now do your ankles. I want you to plantar flex, dorsiflex, inversion, eversion, and rotation. For range of motion noted to the ankles bilaterally. I'll now assess the strength in the lower extremities. We'll start with your ankles. I want you to push my hands up, push my hands down. 5 out of 5 strength noted to the ankles bilaterally. We'll now do your knees. I want you to push my hands up, okay, and push my hands back. 5 out of 5 strength noted to the knees bilaterally. We'll now do your hips. I want you to push my hands in, push my hands out. 5 out of 5 strength noted to the hips bilaterally. We'll now assess the range of motion of your hips and your knees. You can stand up for me. Okay, I want you to mimic my movements. We're going to start with your hips. So I want you to flex, extend, hyperextend, circumduction, and then abduction, adduction, internal rotation, external rotation, other side, flexion, extension, hyperextension, circumduction, okay, and then abduction, adduction, internal rotation, external rotation. For range of motion noted to the hips bilaterally, I'll now assess the knees. So I want you to flex, extend, hyperextend, other side, flex, extend, hyperextend. For range of motion noted to the knees bilaterally. We'll now move on to the spine. I'm going to inspect and palpate it. There's no tenderness or deformities noted. There's normal curvature to the cervical, thoracic, and lumbar spine. Bend over for me. We're assessing for scoliosis. The shoulders are symmetric and there are no deformities noted. Patient is negative for scoliosis. We'll now assess the range of motion in your spine. I want you to mimic my movements. Flex, extend, hyperextend, lateral flexion to the right, lateral flexion and rotation. For range of motion noted to the spine. We'll now do your cervical spine. I want you to flex your head, extend, hyperextend, lateral flexion to the right, lateral flexion to the left, and rotation. For range of motion noted to the cervical spine. We're now going to assess for Romberg. I want you to stand with your eyes closed. There's no swaying. Patient's balance. Romberg is negative. We're going to assess your gait. Walk to the edge of the rug for me and back. Gait is steady and balanced. We will now assess tandem gait. Heel to toe forward and then heel to toe back. Tandem gait is steady. We'll now assess the hopping on your right foot and hopping on your left foot. Patient is balanced and steady. And this concludes my assessment.